Hello, friends. So today we are going to be discussing the subreddit, Emergency Medicine. You may be wondering, well, why would you be doing that? What's up with that? This place is a breeding ground for some of the most insane takes that I have ever seen, and the amount of medical practitioners in here just blatantly admitting that they judge a patient based on how they look, the conditions they have, if they have a psych history, is kind of affirming because it really makes a lot of sense. So I'm going to be discussing a post that just came up because I was in bed, I am sick, and because I frequently go into this subreddit because it is shocking, and I just sometimes need to remind myself how shocking it is. I got recommended this post called Difficult Patient Red Flags. We're gonna see what those red flags are. So they go on and on about, I read a long narrative about how a user's complaint was disregarded time and time again until finally a good doctor listened to them, and they received the diagnosis they always deserved. Of course, they were on their deathbed at the time of the diagnosis, but they were saved just in time by that singular doctor. That story inspired me to compose a list of difficult patient red flags. Okay, so let's start. First one, brightly colored hair, particularly blue or green. I don't know why blue and green are the worst hair color to have for this particular practitioner. But yeah, don't go if you have brightly colored hair, because you're going to be a difficult patient. So that's nice. You ask for food or something to drink immediately upon arrival. Now, I can understand this to a degree. I, as a chronically ill individual, have had many instances in the ER. And I know that you're not supposed to have anything to eat or drink until you've been evaluated and had tests run. But just because you're a little hungry, a little thirsty, it doesn't mean you're going to be a difficult patient. But okay, I can kind of see that one where maybe that's like, interesting that that's the first thing you ask for. I can kind of see it. So that'll go into a category of, okay, next one. If you come in carrying a stuffy or a pillow, hey, you've been to the ER and you know it's insanely uncomfortable and you want to bring your pillow from home because you know you're going to be there for like 8 hours and might not even get a bed? Fuck you! You're not allowed. Or, hey, are you autistic and on the spectrum and a stuffed animal will make you calm down during this difficult time where you will be in the ER and are in the ER because I assume you're experiencing something emergent, so the stuffed animal will provide you comfort? Well, fuck you! Get out of here! You're not allowed in this person's ER. You arrive with a packed bag, assuming you will be admitted. I have never admitted a person who arrived with a packed bag. I'm going to assume that they're lying. Also, sometimes I just carry around a lot of shit. It might not even be a packed bag, but I carry around a lot of stuff because I know I'm going to be in the ER for a long time. So something to keep me preoccupied because I know it's going to be a long time because ER times for waits has gotten increasingly longer since COVID. So don't bring a lot of stuff or else you're a problem. You're a grown adult, but you have required your elderly parents to accompany you to the ER. Hey, you felt really shitty and you couldn't drive yourself and you were at your parents and had to ask them to take you and they're concerned and want to sit with you? Fuck you! Get out of here, you faker! How dare you? And I love how they have stated you have required your elderly parents, as if any time there is a situation where a patient comes in with their elderly parent, they have required it. They are forcing them to sit there. Oh, what a horrible person for wanting company. As if also they're assuming that the parent can't make the decision for themselves to come or not. Next one. You require a visitor or a family member to speak for you because you are in too much pain to speak for yourself. Hey, You screaming because you're in a lot of pain because something emergent is going on and you can't express what's going on properly, so you need somebody as a medical advocate? Well, fuck you. Get out of here. Do they proofread this and recognize that what they're saying makes absolutely no sense and is terrifying to admit to? The next one. You loudly and persistently scream, moan, or cry. Hey, you're in a lot of pain so bad you had to go to the ER and you're screaming? Well, shut up. Shut up. I don't want to hear that. I don't want to hear that. I've been working a long time. You're screaming, difficult patient, faker. So to scream is a sign to you that someone's a difficult patient and doesn't actually need to be in the ER? To be in enough pain that you're screaming and crying means that you shouldn't be there? What? I don't think that you hear what you're saying. You come in due to cyclical vomiting, which means that you've been vomiting over a period of time. It's not just like constant, but it's over a period of time. Hey, you've been vomiting for a week and you don't know why and they can't figure it out? Well, screw you. Just keep it in. That's what this person does. You have more than 3 or 4 medical allergies. They are targeting people that have mast cell activation syndrome like myself, because a lot of practitioners don't believe it really exists, even though there's scientific evidence. So if they see it, they're like, oh, that's a faker sign right there. They're not really allergic. Let's slip them a little almond and see if they break out. Not that they would actually do that, but I'm sure in their mind, they're thinking it. They phrase this next one so bizarrely. Absent of an acceptable severe chronic illness or condition, you have had more than a few ER visits in the last year or have been seen for the same complaint more than once in the last month. What is an acceptable severe chronic illness? What's acceptable to you? I want to know. I want to see their list. What is your list of acceptable severe chronic illnesses? We'll see if me and the rest of my community fit in, because I have a feeling we don't. And I know that we don't, because down further in some of their replies, they have specifically mentioned Ehlers-Danlos syndrome. Because, hey, screw us, right? Next one. Chronic pain generally, chronic back pain specifically. Hey, you have chronic pain and you're in the ER, even if it's for an issue that doesn't relate to your chronic pain. You're just taking up space. You're a faker. You don't really need to be there. Why are you really there? I have had so many instances where I have gone to the ER for something that has nothing to do with my chronic pain, and they will reply, well, we're not going to give you narcotics. And I'm like, I didn't ask. All I wanted was for you to treat my kidney infection, which is the most recent incident of that occurring. Frequent visits for alcohol withdrawal, hyperglycemia, and/or pseudo seizures, which is just a vast array of different things. Hey, are you an alcoholic? You're a difficult patient. Don't ever go to the ER. We hate you. Hyperglycemia, you're diabetic and you're going to the ER? Get out of there, you faker. Pseudo seizures? Obviously faking. You're just having an anxiety attack. You walk into the ER from the parking lot, but once you come in through the door, you ask for a wheelchair. Just tough it out, buckaroo. The wheelchairs are for the actually sick people. You don't need one. This is all one person's post. During triage, you have an ever-expanding list of medical complaints. Now, I can understand this one, that it can be hard to narrow down exactly what the primary complaint is. I can get that one, how you could see that a patient presenting in that form might be a difficult patient. I can semi-agree with that. At the same time, a patient may come in with multiple different complaints and they're not exactly sure what's connecting to what. So you can see both sides, but hey, there's a point for you there. You had one that wasn't completely horrible. When asked, "What's brought you in today?" you respond with, "Where should I begin?" Don't be frustrated by the fact that you're in the ER and things aren't going your way and you feel sick. Be chipper and cheer, and don't say this phrase. Don't use this phrase, or you're difficult and a faker and a liar. You utter the phrase, "I am," or "my immediate family member is a nurse. Other nurses are the worst patients," in capital letters. I have never been a nurse or seen a nurse in the ER, so I cannot comment on this, but it's very bizarre, especially considering I'm assuming that this person is a nurse because they said other nurses are the worst patients. So God forbid they ever have to go to the ER because they're going to be the worst patient, apparently, according to their own preconceived notions. History of M1 holds. And if you don't know what an M1 hold is, that is a psych hold. So if you have a psychiatric history and are coming into the ER, you're difficult. Ugh, get out of here, you freak. You crazy person. We don't see your kind here. Last one. Numerous FYIs, for your informations, in your chart indicating you have a history of violent and belligerent behavior. Okay, another point for you. I can understand how seeing that in somebody's chart could make you believe that this person is going to be difficult because they've been difficult potentially in the past. Okay, so out of all of those, you've been given 3 that I can kind of, sort of, maybe see your point of view. The rest, what? Now we're going to go through the comments where it's other individuals chiming in. You're going to need an ultrasound from me. I'm a hard stick. They'd freaking hate me because I am a hard stick because I have to go into the hospital often for procedures. And so my veins are terrible. So I would think that me telling you ahead of time I'm a hard stick would be nice information to have. Okay. Cartoon PJs in an adult. You like cartoons? Specifically, they state Cookie Monster or SpongeBob? Screw you faker. Ugh, get out of here. Get changed, you weirdo. You like cartoons as an adult? And wear merch? Shocking. Absolutely shocking. This is the one. This is the one. This is the one. This comment. History of fibromyalgia, POTS, postural orthostatic tachycardia syndrome, and Ehlers-Danlos syndrome. This is what they all want to say, and this is what they have been saying constantly in this subreddit in so many different posts, and that's why I continuously go in, because I am shocked every time. I shouldn't be shocked given the treatment that I have received as soon as I have told medical practitioners my diagnoses, but still it's shocking. The amount of disrespect, judgment, and just a lack of care from all of these professionals that are in an emergency setting is terrifying. If you agree with the things that are stated in here and you work in the medical field, you should be ashamed of yourself because you are admitting to biases that could potentially lead to a patient being treated differently and an emergency being neglected. Sorry to go all, but I think that those are things that need to be stated. To have this many biases and to work in emergency medicine is terrifying, it is shocking, it is appalling. Isn't the first rule of medicine do no harm? I really think that having these biases so deeply rooted into your beliefs that you have to go and make Reddit post after Reddit post about it in your little subreddit shows that you are doing harm. That there are likely patients that come in that don't fit your specific criteria, which is a lot of boxes that you need to check to be a good patient for you. If they don't fit into your criteria, you're going to treat them differently. You may think that you're not going to, but clearly you felt strongly enough about it to make a Reddit post about it. So clearly you feel strongly enough to probably not treat them the way that they should be treated. I understand that medicine is, especially after COVID and in the ER, a horrifying environment to be in, and it is genuinely a place filled with overworked nurses, and staff. That being said, I'm gonna be completely honest, the vast majority of people going to the ER do not want to be there. You may think that they just want to be there, that they're just faking, that they're causing trouble and just want attention, but that is probably such a small percentage of the people that you are assuming. And you're doing harm by just going off of these judgments, things that some people cannot change. Sure, with the hair color or the clothing, people can change that. But I can't change what I was diagnosed with, what I was born with. And because of that, you're going to treat me differently. Because of that, you're going to judge me and go online and complain about patients such as myself. That is disgusting behavior. And you're sharing it proudly. You're like screaming it from the rooftops. You're proud of this. Maybe you should reevaluate some things, because that is not the kind of nurse or doctor that I would want taking care of me. And the whole point of this is that they are writing this in regards to some individual talking about how their time was disregarded time and time again until they found a good doctor to give them the diagnosis that they needed. You don't know it until you live it. And I have lived it, and I've shared my experiences, especially with all of the preconceived notions that you have. A lot of those individuals are going to spend a lot of time going from doctor to doctor to doctor trying to find a diagnosis because people like you don't believe them when they say they're in pain. And that's the truth of it. You're the problem. You're the problem. It's not the patient. It's you. So yeah. Thank you for watching this video. If you're the person who made this Reddit post, you're on my shit list. Sorry. Maybe if you take some time to really think about what you are putting out into the universe, maybe you'll get off of that list. But for now, I don't really like you. And I kind of really am praying that you're never my nurse. Anyways, thank you guys for watching, and I'll see you in the next video. Bye!